everyone. This is Kristen Brown again. I'm an account manager here at VisualDX. Thank you all for joining us today. I know you all have busy schedules, but I do appreciate you taking the time to learn some more about VisualDX. We are a clinical decision support tool that is funded by the VA Library Network Office, and we've worked closely with them to promote this webinar, and as well as Dr. Brian Hoyt, who is a chief resident in dermatology, and he practices at Dartmouth and the White River Junction VA. So I'm going to hand everything over to Brian in a moment. If you wanted, all just mute your lines. We do have the chat function open, so if you have any questions along the way, certainly send me a message and we'll address them. But without further ado, here is Dr. Hoyt.
Okay, great. Thank you, Christian. And thank you to those of you who've tuned in. I'm a member of the VisualDX Advisory Board and have used VisualDX for several years once I discovered it and have found it to be very useful. I'm currently serving as chief resident for the Dartmouth-Hitchcock Dermatology Residency Program and also serve at the White River Junction VA in the dermatology clinic there. Today we'll be talking about VisualDX not just as a tool for dermatology, though it's great for that purpose as well, but how it can be utilized beyond skin conditions for emergency room or internal medicine or other specialties as well. So we'll be talking about how to use this tool. I hope to make this useful and informative and an efficient way to learn how to use the VisualDX system. So like I said, I'm a member of the VisualDX Advisory Board. That means I help with product improvement and developing new ideas and new products with the VisualDX program. This presentation is not sponsored by the Dartmouth Dermatology section and does not represent an endorsement, and it's not intended to be a replacement for a dermatology consult service. So if you run up against a rash and you're not figuring out what it is, please utilize your local dermatologist, but VisualDX really can get you started in the right way and help in that process. So what we'll talk about today includes how to use VisualDX. It has a useful and pretty unique differential diagnosis generator that I've found to be an invaluable tool. We'll talk about how to use that for skin conditions, but also for general medicine conditions. And then we'll review some other tricks and tips for using VisualDX in a clinical setting, ways to use it as well in patient education. And lastly, we'll talk about how to set up the mobile device. So through the VA library, you have access not only to VisualDX when you're at work, but you can create a login that allows you to have access to the app on your phone, which is very helpful, but also to access it once you have a login. So we'll talk about how to get set up on that as well. A little bit of intro before we go to the website and kind of review how to utilize it. Can you see my cursor on the screen? I'm going to be pointing some things out. So here, when you go to VisualDX, you'll get the main search page, and so you'll be able to see this icon and the search bar, and then also the option to start a differential diagnosis or use the differential builder. In the search tab, you can search by a chief complaint. You can also type in a medication, and it will give you common reactions to that medication, or you can search by a travel location for someone who has a unique travel history. That can help to kind of get you started. But what I really want to hone in on today is this differential diagnosis builder. It's a unique algorithm that helps utilize multiple inputs, and so you can start right off by clicking on the differential builder, and then it gives you the opportunity to pick your chief complaint, and then you kind of build or add on from there. Once you've selected your chief complaint in the differential builder, it will allow you to add additional findings, both from the patient's history or from their physical exam, that will help hone in on a narrower differential diagnosis. VisualDX recently added a tabulated system for the results of that differential diagnosis generator, and so it gives you the option or the suggestion, the tabs to consider first. So these are common or life-threatening diagnoses, and then consider second as other kind of less common, more rare things that may meet the findings that you've entered. There are also options to select infection, drug eruptions, or you can view all of the findings. One other thing that I want to point out is the differential strength indicator, and this is a useful tool to kind of figure out how useful the findings are that you're inputting into the system as you add more things, add more clinical findings or history elements. So the more that you add, the better your differential will be. So if all you type in is cough, the differential is going to be huge. But if you type in cough and skin eruption and history of travel, you're going to narrow it down. So that's a good indicator for how useful the information is that you're putting in and how specific a result you're going to get. So again, here you'll see the workup for the chief complaint, whatever you select from that initial menu. And then you can go through these tabs and add whatever findings are relevant to your patient. You also can type in additional findings, which can be a very useful additional way to find specific things that you may be considering. One neat thing about that is you can add in medications that the patient is on. You can also add in travel history just by typing the name of a country. So that's a unique feature that helps to narrow down your differential. And on the right is a summary tab that shows all of the findings that you've inputted. You can see that fever is selected over here, and then it will show up on the right here. If you want to make that a required element of the diagnosis, you can select the button here, and that makes it required as part of the search. So I want to walk you through a case. This was a 15-year-old male who presented with an itchy rash. He had been hospitalized for a week or two with a necrotizing strep infection of the right leg, and he'd undergone several debridements. He'd been treated with vancomycin and ceftriaxone, and this rash was new in onset in the last day or so. It was intensely itchy, affecting his sleep. He didn't have any fever, and they consulted us to say, what is this? What do we do about it? And here are a few more clinical photos just to give you an example of what we're seeing. And I want to take you over to the actual Visual DX website. So this is the main web page that you'll come to when you type that in from the VA when you're on the VA network. You also can go to va.gov/library. So va.gov/library. And that will take you to a list of the clinical resources. And from there, you can select Visual DX under Find a Database. That's another way to get there. So from Visual DX, this is the page. And start just typing in fever, for example. It gives you the option to search for specific fevers or build a differential diagnosis. Now, I want to go back to our case and walk us through the case of that patient with the blistering rash. So you click on the differential builder. Our primary concern was dermatology with that patient. He had the blistering skin rash. So we selected multiple skin lesions. And then it pulls up this option where you can select what type of skin lesion it is. And unfortunately, they don't have a maculopapular button. So you have to know a little bit about the morphology, but thankfully there are pictures that help guide that. So you can select, he had vesicles and bullae. You can select multiple morphologies as well, and you see that they show up here on the right. If I want to make that a requirement for the diagnosis, I can also select that button, and that then makes it required. He was a male patient, in case that is relevant. Then you can click down this tab on the left and add more specifics. So he had his rash on the arms, mostly on the arms and legs, some on the trunk. The distribution was symmetric on the extremities, and you can select as many or as few of these as you want to. You don't have to select any of them. As far as symptoms and signs, he did not have a fever, so I'm going to leave that blank, but he did have intense itching. And then the timing of it developed pretty quickly. So it was within a day or so that he developed this rash. Otherwise, he appeared well. Again, he was afebrile. And then with medical history, none of these are relevant to that patient, but he had been on vancomycin. And so you could type in a medication. He'd also been on ceftriaxone. And so we can add those to the list of, well, if this is drug-induced eruption, well, what kind of eruption is it, and is that playing a role here? So with those findings, you can see we have a good differential generated, and so we'll click on View the Differential. And so then it pops up the differential diagnosis screen. So here's the things to consider first. These are common things that you would want to think about, or life-threatening things. So you think about herpes zoster or shingles. As you hover over the diagnosis, it will give you a list of all of the criteria that you entered, including which ones are met by that diagnosis typically and which ones generally aren't. So for example, you see the medications are crossed off. Usually zoster is not induced by a medication. And so you can scroll down. Some of these clearly don't make sense. I mean, he wasn't outside, he wasn't getting exposed to poison ivy, for example. So you can pretty quickly scan through this list and consider if there are any of these that may fit in this case. In his instance, we had a pretty high suspicion for a drug-induced cause, and so I'm going to show you that tab. Again, there are other less likely diagnoses under the Consider Second tab, emergency diagnoses, and then infectious etiologies. And so under drug-induced, it gives you a more specific list of possible diagnoses that fit a lot of the criteria that we entered and that are commonly triggered by a medication. So you can scan through that list. And one thing I want to show you while we're on this view is that you can select to view either by photos, which are clinical pictures of a condition, or by sympticons. This is a kind of unique way of viewing things where when the actual skin findings are limited, this gives you a good summary or synopsis of what are the salient or key features of each diagnosis. So for example, bullous pemphigoid, what you'd want to look for is tense vesicles, itching, and tense bullae. So could it have been a drug-induced bullous pemphigoid? Certainly is on the differential diagnosis list if you just want to see it as text. Again, they're organized by how well it fits these findings. His was too widespread to be a classic fixed drug eruption, and biopsy confirmed the diagnosis of linear IgA dermatosis. I'm going to go back to the photo view. We'll select linear IgA. This is an uncommon form of a drug eruption, and when you click on it, it gives you this preview where you can read. Also, it has links to other references or resources that you may want to use. You can also scan through the pictures on this view and see how your diagnosis fits with the images. You then can click on to see the full article, and from there you have the option to view the various images. One thing I want to point out here is that often when people have a dermatologic rash or skin concern, they do a Google search and type in blisters on the arm or something like that. That's a much less elegant way of searching, and even if you were to do a Google search for linear IgA, there's nobody vetting those photos. There's no way to know that you're not seeing a picture of bullous pemphigoid, for example. One of the things that I found really helpful about Visual DX is that it gives a little more validity and reliability to the clinical photos. So it's really helpful in that regard. Let me walk you through this page that shows what information is available for each diagnosis. So you can, if you want to, just print this whole page with the summary, and it gives you the option to select a picture that you think fits best. And this is something that could be distributed to other clinicians or brought to grand rounds for discussion, or even distributed to patients in the right setting. And so it starts with a synopsis of the condition. One thing that's helpful is they include the ICD-10 and the SNOMED codes for these diagnoses. And all of these articles are written by clinicians who have experience in this field or this specific area. So there are clinical pearls that you may not find in a textbook, for example, that shows you specifically what to look for, and other diagnostic pearls. So group blisters on the extensors, this patient had that, and the extensors are a common site for linear IgA. So these kind of pearls are very helpful when you're trying to narrow down your differential. Another thing that I really like about the Visual DX page is that it breaks things down into a differential diagnosis. And so you see that there are multiple other conditions listed that, it's not just a regurgitation of what we put in for our differential generator, but this is, if you're considering a diagnosis of linear IgA, these are other things that you would want to think about. And then they talk about how to confirm the diagnosis, the tests that you need to do. So we did a biopsy on that patient for both light microscopy as well as direct immunofluorescence, and confirmed the diagnosis of linear IgA. They have pearls for management and therapy, and these are very specific. They'll give specific names of steroids that you may want to consider, or other treatments that can be tried regardless of whether it's a skin condition or a general medical condition. These therapy pearls are so I found that to also be a really useful part of the summary page. Another feature that I think is very helpful is that they have a section for associated medications. And these are medications that have been reported to cause this type of eruption. And so you can scroll down and look for ceftriaxone. There's one reported case of linear IgA triggered by ceftriaxone, and you can click on it and it shows you the reference. You can click on the link and go right to PubMed to see the article. It's a really quick way to look at other cases that may have a similar history. The other patient, the other medication this patient was vancomycin, and so here you can see quite an overwhelming number of references of vancomycin-induced linear IgA bullous dermatosis. Numerous references. You can click on all of them and read more about it. And so that's a great way as well when you're considering, well, this is a drug-induced condition, what drug is most likely? And this is not a statistical number, but it's just number of publications that link the rash to that medication. So in this patient's case, it's much more likely that vancomycin was the offending agent, just based on the clinical associations that have been reported in the literature. And finally, there are references at the bottom for additional information about linear IgA. So that's a good example case. If you want to view the photos, you can scroll down and look at all the photos. You also can filter the images. So if you want to see images based on a location or a skin pigmentation type, you can narrow it down. So for example, if I just wanted pictures of the arm, it's a good way, if you have a lot of images, to narrow it down and find an image that may fit what your patient is manifesting. So that's an overview of how to use this for a dermatologic condition. I want to go back to the home page, so click on Visual DX in the top left, and it brings you right back here. And I want to do another one with more of an internal medicine spin. And I really wish that I had known about Visual DX when I was in medical school or in my internship. There are numerous instances where it would have provided helpful expansion of a differential diagnosis or helped us to narrow down on a diagnosis in the medical setting. So I want to review another case of a 40-year-old veteran who presented with fever. That was their presenting complaint. And then as you know, this isn't a skin finding, so the options given here are different. So first is the onset, and it developed over days to weeks. You can then click on the appearance of the patient. The patient appears ill, looks unwell. Again, I'll adjust this. So 40-year-old male veteran. And then under vitals, the patient demonstrates tachypnea and tachycardia. If you are not sure what these descriptions mean, obviously not the case in this description, there are definitions. So if you're not sure what hypotension is, you can click on this and that gives you a little hint. And then as you continue to click through and add more findings, the strength of your differential will grow stronger. So I want to also add under neurologic, the patient had altered mental status. So you can click on mental status alteration. Another way that you could do that is by typing it in the additional findings. So if you were to type in altered mental status, you can click on it that way. And then you can also add findings from the physical exam that may help in narrowing down your differential. This was acute, so there were no relevant weight changes. And the patient did also manifest prolonged capillary refill. So you can type in capillary refill. And so that is an additional finding that you can add. Patient didn't have any skin findings, but it gives you the option to add that. As you get labs, you can add those in as well. So if they present with leukocytosis, you can include that. And then any pertinent social history. So are they sexually active? What kind of occupation are they? They're in the military, and you can expand on it further from there. And then you can add further medical history, travel history. You can type things in here if you feel like there are other exposures or travel history that is relevant. So I'm going to go ahead and view this differential diagnosis. And here on the consider first, there are the most relevant or the most life-threatening diagnoses that fit with the things that we entered. In this instance, the patient was presenting with sepsis. Here you can see that the default view for sepsis is the Sympticon, so the image that has the salient findings for that diagnosis. We can also, again, change to photos and see pictures of either X-ray findings or skin findings for that diagnosis. So again, if we click on bacterial sepsis, we get a summary, the Sympticon, showing that often patients present with fever, with pain, tachycardia, chills, tachypnea, things that we saw and were evident in our patient. You then can go to the full article to read more about the diagnosis of sepsis. It has a pretty extensive summary, synopsis of different types of sepsis or bacterial etiologies, clinical pearls, so things to look for specifically, what to look for if you're considering a possibility of endocarditis, and then also differential diagnosis. This also is really important to avoid jumping onto one diagnosis and becoming fixed on it. It helps us to think more broadly and think about things that maybe you wouldn't, like leptospirosis. And if you want to investigate that more, you can click on that and jump to read about another condition on that differential. So you can expand a lot from the initial differential that you generate. You then can look at the best tests, the management pearls. I won't go through all of this with you, but it's pretty comprehensive information. Therapy is more dependent on having a specific bacterial agent identified. And then there are, again, associations and references down below. So that's a good example of how you're setting with a primary medical concern. Again, you can do the same thing looking at images. There are the Sympticons, and then clinical images of patients presenting with sepsis. So I want to go through one other case with you, and this is looking at the travel history feature. So we have a veteran who's returning from India and presenting with a primary complaint of arthralgias. And so we click on joint pains, and we can type in India, because he had that travel history, and go through the symptoms. Patient is manifesting with malaise and headache. The onset of findings was over days to weeks, and you can determine where the pain is located. That can be helpful with specific regional pain. In this case, it was more widespread. The patient appeared ill, was not well appearing. If you forget to add something before or don't know if it's on this list, you can just type it in, so fever. And if you want to make any of them required, you can also add that. So you could say that you want the fever to be a necessary part of the differential that's generated. You can further narrow down the arthralgia subtypes. So is it a migrating polyarthralgia or not? And then we entered in the travel history already, and you can also add in physical signs that they may be manifesting. You can type in other specific concerns, so for example, photophobia. And as you go through the differential diagnosis generator, it's important to not feel limited by what's on this column in the left. So you can type in almost anything and add it to your differential. So then we'll go and look at the differential. It automatically brought us to infection, but we can also select the consider first. In this case, we were worried about an infectious etiology and patient coming from India. It's hard to keep straight which viruses or parasite. Ability to add in a location is really a unique and helpful feature that saves you having to go to the CDC's website and say, well, does chikungunya affect people in India, or do they have Zika in India? And so it helps you to narrow it down by the location. As you highlight over the diagnosis, you can see under the findings that India is listed as one of the matches. So chikungunya is endemic in India. That's what this page more about chikungunya, which is not a common, and you may not think about it or may not be forefront in your mind. But as you enter in the specific findings, you can learn more about it. Jump to the page, look at skin findings manifested in patients with chikungunya, and then also see what other things you would want to consider. So it's a really great way to search by the especially relevant working with veterans, because they may be coming back from the Middle East, they may be coming back from Asia, and knowing which conditions are in which location can be challenging to keep straight. So I think this is a really helpful way to someone's travel history. If you forgot to add something and you want to go back and add it, you can go back to the differential diagnosis generator and add in, oh, they're also having abdominal pain, and pull up the differential diagnosis generator again. If all these symptoms were drug-induced, the things that you would want to think about, you can pull up the drug-induced list. So again, these tabs are consistent regardless of what type of search you are doing. The next thing that I want to show you is on the Visual DX homepage. If you want to search by diagnosis, you can also do that. So you don't want to use the differential diagnosis generator, but you're thinking maybe a patient has bullous pemphigoid. Well, what do they look like? And you can type in bullous pemphigoid and just pull it up straight as a diagnosis without going through the differential generator. And so here's a page that goes through bullous pemphigoid and talks about what it is, clinical pearls, but also gives you almost 100 clinical images that you can scan through. Again, they're more reliable than a search engine search of bullous pemphigoid, and you can get a good sense for what this condition looks like. Tense, vesicles, and bullae. Again, you can filter images, so if you want to see what bullous pemphigoid looks like in a darker skin type, you can search by skin pigmentation, you can search by location. What does it look like neck, for example? I mean, you can be very specific in that. And so that's a really cool tool, a quick way to get to a specific diagnosis that you may be wanting to look at further. Another example, we had an experience at River Junction, VA, not too long ago. We were biopsy until we saw one of these critters fall off of the patient's clothing. The PA who was seeing that patient scooped it up into a specimen bottle, and we were able to search and find what it was. So we were suspicious that it might be a bed bug, and we typed in bed bug, and you see many good examples of bed bugs. And you also see the bed bug bites in the breakfast, lunch, and dinner configuration. And so this is a really good way to reliably find pictures that can help support your clinical decision making. Again, you can go to the synopsis page and read about the diagnosis, the risk factors, the treatment, etc. So you can search basically any diagnosis and find great, reliable photos that will help in narrowing down a differential diagnosis or also in patient education. One other thing that I want to point out is the patient education tools. So, for example, if you have a patient with pemphigus vulgaris, for example, another blistering condition, many of the more common conditions have a patient printout where you can go to that page. You can select information for the patients, and it's a more manageable that they have. And their own skin, their blisters, tells them when to seek medical care, and also gives them a brief overview of treatment without obligating you to a certain treatment course. So these are really helpful handouts that can be used very easily, quickly in the clinical setting. When you go to print them, you can also select which pictures included. So if a patient is not sure of your diagnosis, or you want to help them see, oh yeah, it looks just like this, it kind of supports your diagnosis, you can select through and select the picture that seems most pertinent for that patient. It's a nice way to customize your after visit summary or your handout for the patients. And then you also have the option to email it to a patient or to somebody else. So that's another great tool to use when you're in clinic on the fly. And patients also find viewing these images very helpful. So if they present with a condition, for example, I had a patient who presented with erythema nodosum. You can come to the search bar here or from the home page and type it in. She was a little skeptical of the diagnosis, and so I was able to pull up this database with tons of clinical pictures and show her one that looked exactly like her legs. And she was much more excited about getting on board with that diagnosis, and it helped her to gain confidence in the diagnosis. And then we could print off information for her with that diagnosis. So it's a really helpful tool, not only for clinical decision making, but also for patient education and teaching. The last thing I want to show you today is how to get the mobile app. So if you have access to the Visual DX through the VA computers, the best way to get the mobile app, well, the only way to get it is to go to Visual DX when you're at the VA. And when you click on Visual DX, you'll be brought to this web page, and you can then select Get the Mobile App. It will then bring you to this screen where you can create a personal account. So again, this has to be done on the VA intranet, but you enter in your username and create a password. That will be your username and password when you go to Visual DX from an off-site location. You don't have to log in through the VA to get to Visual DX. Once you have a personal account, you can just go directly to Visual DX and use your account. This is very quick. It takes about 30 seconds, and then you create an account once you've put in all of the relevant personal information. Once you have an account, you then go to the App Store on your phone and download the Visual DX app. There's no charge for the app, and so once you have the app downloaded, you then log in with your Visual DX account that you create here. Log into the app, and they'll be able to associate you to the VA, and then you'll have access to Visual DX on your smartphone, on your iPad, to use in a clinical setting or when you're on the go as a quick reference. So that's how you get the mobile app. I would strongly encourage you to use that. It's very accessible. It's easy to use. It has basically the same format as the Visual DX website. One other perk of the app, a useful feature, is there's a quiz feature on the app. So you can basically review photo quizzes or even the Sympticons, and basically, based on pictures, quiz yourself. And I think that's really helpful for any clinician, and particularly those in dermatology or working with dermatology patients. But you can quiz on emergency medicine conditions or on ophthalmology conditions, so you can customize it, and that's a great way for education for medical students or residents to quiz themselves. So I think that's about it in terms of an overview to the Visual DX website. I appreciate your attention and hope that was useful, and I'd be happy to answer any questions that people have about how to use this interface or ways to take advantage of the Visual DX tool. I think you're probably muted, but if you want to unmute yourself, if you have any questions, feel free.
Hello, Brian?
Yeah.
Hi, can you hear me, Brian?
Yes, I can hear you.
Thanks. Brian, this is Prashant Kaushik. I'm the rheumatology lead physician at the Albany Stratton Medical Center. Thank you for a great presentation. Just a couple quick questions. First one is pertaining to the use of Visual DX. So do you start by typing in Visual DX, hold on, the site that you gave us on a VA computer, visualdx.com. Is that how you get to this app?
Yes, so you can, from the VA, when you're on a VA computer, you can type in visualdx.com, and it should bring you right to the website. Okay. The other option is to go to the VA library website,
so
and that's...
I'm sorry, so va.gov/library?
Yes.
And then?
And then you scroll down to find a database.
So scroll, one more time, please, if you can show us how to scroll down. Where to
scroll. So when you go to va.gov/library, it'll bring you to this page. If you scroll down, you can see find a database.
Yes. Perfect.
And then if you select that, it gives you all the databases that the VA subscribes to, including Visual DX.
Thank you, Brian. That's very helpful. And the second question was regarding as to how you actually came up with the photo quiz option. I missed that part, please.
Yeah, so the photo quiz is currently available on the mobile app. So if you create a personal account and download the mobile app, then from the homepage of the mobile app, you can then create a quiz.
Okay, so it's available only on the mobile app. Okay, okay.
Yeah.
Thank you, Brian.
You're welcome.
Hi, Brian. This is Kristen Brown. I just noticed that there is a question on the chat function.
Oh, sure.
It says, is there an option for you to take a picture of a lesion, then get a differential diagnosis for that lesion? Do you want to talk to them a little bit about Derm Expert?
Yes, yeah. So that's kind of an exciting next generation of Visual DX. And in an upcoming product, there is that option where you can take a picture of a clinical rash or lesion and then generate a differential based on the photo. That's a pretty new technology, and I think one that is going to be certainly growing in use. And I've had opportunities to use it a couple of times, and it's pretty impressive. So yes, that's up and coming, and I think it's available on maybe Christian, you can maybe speak to that better, but I think it is available maybe on the premium version of Visual DX, but should be available on a more widespread.
Yeah, so currently Derm Expert is available for all Apple iOS users. It's an additional, there is an additional fee associated with that. So if anyone's interested in any more information on, creating a personal account for Derm Expert, certainly feel free to reach out to me. I'll send a follow-up email to everyone that joined with all of my contact information. But that is a new feature that we've just recently launched.
Yeah, and it's pretty amazing. It looks like Ruth asked a question about the username and password. That sounds like a question about getting the mobile app. So when you click on create a personal account, you have to create an account from the VA computers before you can log into the mobile app using your VA access. And so here, if your name was johnbrown.va.gov, or the email is there, or at VA.
Brian, it doesn't let us see what you're doing anymore. There's a hazy thing up on the screen. Yep.
Okay, thank you. Let's see. Let me try starting it over again. Can you see now?
Yep.
Okay. So if you go to Visual DX, get the mobile app, and then create a personal Visual DX account, then you use your email as a username, so johnbrown@va.gov, and then create your own password, put in your first and last name, select your profession and specialty, and then that's it. That's all you need to create a personal account. Once you have that, then your username and password to log on to the mobile app is your email address, and then the password that you create here.
That's very helpful, although the screen was still hazy, but I think we got the notion. Thanks, Brian.
Okay, sorry about that. All right. I'm happy to take any other questions. If not, one other thing I would just encourage is that as you are in a clinical setting, this is a great thing to teach other providers about. Everyone has free access to it through the VA, so share it with medical students, with residents, with other physicians and mid-level providers, and I think everyone can benefit from this resource.
All right, well, I guess if we don't have any other questions, thank you so much, Brian, for that presentation. I think everyone found it really helpful. And thank you to those that joined. Again, if you do have any questions, feel free to reach directly out to me. My email, just so you have it, is cbrown@visualdx.com, and I'll send a follow-up email after this call as well. But before I sign off, we did just get one more question in. So it says, I have this on a mobile app, but how do you get this on your desktop? So desktop version is just run from the web. So just go to visualdx.com, and then you can click the launch button. As long as you're at a VA computer, you wouldn't be prompted to sign in. If you have already created a mobile personal account, you can access it from any personal computer.
And if you're trying to access the desktop version outside of the VA system, then it will bring you to a slightly different web page. But basically what you would do is go to sign in on the top right, and then it gives you an option to enter your username and password, and then you can use the Visual DX website in its entirety without having to go through an intranet or portal or anything like that.
Yeah.
Yeah, and Nancy Clark also pointed out that you can access the va.gov/library from anywhere, and then again go to the find a database either on the left side and scroll down, or scrolling down from the main web page. All right, any other questions? Great. Well, thank you all for your attention and questions, and I hope you found that useful.
All right. Thanks, everyone. Thank you, Brian. Have a great day.